you so much for staying with the program. You're watching Morning Cafe. Being a Thursday, we talk matters health. This morning, we're focusing on arthritis. This is something that has been dismissed as a normal part of aging and more or less the same an older people disease, but is that the case? This morning, we have Dr. Sarah Njeri, a general practitioner, to take us through arthritis. Is it curable? Is it preventable? Is it manageable? How do we deal with arthritis? And in Kenya, it is estimated that 1 in 4 adults above the age of 50 could show clinical signs of having arthritis. And of course, we'll be getting deeper into it as far as global data is concerned as we progress with this conversation. And we invite you to be part of it on our social media platforms, TV47 Kenya on Facebook and on YouTube, and on X at TV47 News KE. You can tag me as well at Ann_Dida, and there will be a number on your screen shortly. We invite you to call in as well. If you have any questions for Daktari, we'll be happy to hear from you. Karibu sana, Daktari.
Thank you.
All right. This might sound very basic, but for the benefit of our viewer and to set the pace for this conversation, what exactly is arthritis? I've started by mentioning that more often than not, this condition has been, referred to and believed to be an older people disease. And even as we talk about the estimated data in Kenya, it talks about adults above the age of 50. Mm-hmm. So what exactly is arthritis?
Okay, so arthritis basically refers to inflammation of the joints. Mm-hmm. And so in layman's terms, that means that the joint undergoes a process where it's eroded and there's swelling, pain, redness of the joint. Mm-hmm. So usually in the general population, mm-hmm. we tend to think of arthritis only as an elderly disease, mm-hmm. but there are various types of arthritis that could affect various ages. Mm-hmm.
Take us through that point now that you say there are various types mm-hmm. of arthritis, and even when we look at the data that is available, it speaks of one type of arthritis, the mm-hmm. other type of arthritis, and then they're brought in together. Then it comes up with a total data in regards to just all these types of arthritis that are available. So what are they?
So I'll start with the most common, which is what many people think about mm-hmm. when we talk about arthritis, and that is osteoarthritis. Okay. So osteoarthritis is the one that actually happens to affect the elderly. Mm-hmm. And I can get more into it, mm-hmm. but we have osteoarthritis. We have a type called gout. Gout is actually a form of arthritis, gouty arthritis. Mm-hmm. And the cause of gouty arthritis is not the same as what happens in osteoarthritis. Mm-hmm. Then we have types like rheumatoid arthritis, which is quite common. Some people may know of it. Mm-hmm. So still, when you refer to arthritis, that could be some of the types those are some of the most common types that we have in our setting. Mm-hmm. And lastly, we have what we call septic arthritis. So septic arthritis just means an infection of the joint that then leads to all those things I described earlier, the pain, the swelling of the joint. Mm-hmm. Then there are other smaller variations of arthritis that come with other systemic conditions mm-hmm. in the body. So, for example, you may find someone with psoriasis or lupus also has arthritic symptoms, aside from also having other bodily symptoms. Mm-hmm. Yeah.
When you talk about lupus, and now that you mentioned it mm-hmm. as one of the signs, now talk to us about diagnosis. Does now lupus, you're saying it sometimes presents itself as a sign of arthritis, mm-hmm. then how does that affect the diagnosis of arthritis?
No, let me clarify that. The lupus won't be a sign of arthritis, it will be arthritis. So lupus generally means systemic lupus erythematosus, mm-hmm. and the systemic part just means that different parts of the body are affected by lupus. Mm-hmm. So lupus could affect the skin, the kidneys, the lungs, mm-hmm. and the joints could also be part of it. Mm-hmm.
Yeah. Still on that question, mm-hmm. that question of diagnosis, mm-hmm. how do you diagnose arthritis?
Okay, so again, we'll refer back to the types mm-hmm. because depending on what you think the cause of the arthritis is, once the doctor sees you and they assess you and think they have an idea generally after examining you what kind of arthritis you could be having, mm-hmm. then they'll do various tests. Mm-hmm. So most commonly for osteoarthritis being the most common type where with age the joints are wearing out, mm-hmm. that we start with just doing a plain X-ray. And usually the X-ray will show some changes in the bone that then point us to the fact that you have osteoarthritis. On top of it, for things like, we do other tests, other blood tests, so we'll check for what we call inflammatory markers. So these are, let me call them chemicals just to make it easy. Chemicals in the blood that will increase when you have inflammation in the body, and that can point us to arthritis. For something like rheumatoid arthritis, because it has genetic factors that play a role, then we do tests like rheumatoid factor. If we still think that that could be what is going on, the other tests that we check for antibodies in the body, because rheumatoid arthritis is an autoimmune disease, so we check for certain antibodies that point us to the fact that you have rheumatoid arthritis. Gout, gout is caused by increased a salt called uric acid. So it builds up in the body, and then it forms crystals, like salt crystallizes and deposits in the joints. So in that case, then we check your uric acid levels. Even an X-ray for very advanced gouty disease, you may see those deposits, but that's a very advanced type of gout. In septic arthritis, which is an infection, we'll do the X-ray. We could do an ultrasound because there's a lot of joint fluid that accumulates due to, it's kind of like pus accumulating within the joint. We'll check for infection in the body, in the blood, that is. And then even that fluid could be aspirated, meaning drained from the joint, and several tests done to ascertain what kind of bacteria is causing the septic arthritis. Yeah.
And when you talk about these types of arthritis, we have gout, of course, osteo and RA, which you've said are the top three. So which one are we seeing more prevalent in the country?
In the country, you'll see mostly osteoarthritis, and that's affecting middle-aged and above, so 50, 60, 70-year-olds who will present with osteoarthritis. The reason being, osteoarthritis happens to be wear and tear. Let me use that for the general public to understand. So with time, there's loss of cartilage within the joint. And cartilage basically refers to, for example, what makes up the nose or the ear. It's not necessarily flesh and it's not bone. It's like a padding of cartilage within the joint. And with time, it wears out due to use with age. So it wears out and you start feeling that the bones are rubbing against each other, and that's why you have the symptoms of pain, stiffness, a lot of discomfort when walking, and so that happens to affect mostly the elderly, and that's the most common type that we have in our setting in Kenya.
All right, so how do they present themselves differently? When you talk about gout, osteo, RA, of course I know they come with different signs, symptoms and outlook. So, and I don't want to ask which one is more painful than the other, because if we're talking about arthritis, then it could present itself with pain. But how do they now manifest differently, gout, osteo, and RA?
Okay, I'll start again with osteoarthritis, our most common one. What happens is, because it's a wear and tear, it tends to affect the weight-bearing joints. So by weight-bearing, we mean the joints that will carry the body weight.
That is the femur
knees, area. Yeah, the knees especially. That's the most common area where you'll find elderly people complaining of knee pain. Some will complain of hip pain, others will complain of lower back pain. So osteoarthritis tends to affect either one or two joints, or even more, but it tends to be the weight-bearing joints. When it comes to something like rheumatoid arthritis, the most distinguishing factor is that it affects the small joints of the hands and the feet. So you find that people with rheumatoid arthritis will be complaining of pain and even swelling of the hands and the feet. And with more advanced disease in rheumatoid arthritis, you find that they actually have deformities of the hands. So where their hand joints are actually bending. So that's rheumatoid arthritis. For gout, also gout, most people think of gout as affecting the large toe especially. That's when you have what we call a flare-up. the disease has suddenly become so severe, and there's swelling of the large toe, with redness, a lot of discomfort, such that you find they can't even cover themselves at night because of the pain. So in general, all of them have joint pain and swelling, and with more advanced disease, you find that there is deformity of the affected joints. But then the different types of joints that are affected and the age then point us to what kind of arthritis we think it is. So if someone comes to us with a large toe swelling and pain, then we're thinking more of gout. If it's the hands and the feet, thinking more of rheumatoid arthritis. If it's an elderly person with knee pain, it's most likely osteoarthritis. Yeah.
Now that brings me to the question of, you've talked about the hands, and of course we have the joints as well in the elbows. So it doesn't necessarily affect only the knee, as we've been told and heard more about.
Yeah, so the reason people again think that it's just the knees, because when we think about arthritis in the general public, we're thinking only of osteoarthritis, and it's true that most osteoarthritis will affect the knee joint. Yeah, but it's not the case.
All right. I've heard about the bigger you are, the more predisposed you are to arthritis. How true is that? It's
actually true, because as osteoarthritis again is what we are referring to in this case.
Okay.
Because as I said earlier, osteoarthritis is affecting the weight-bearing joints.
The knee area.
The knee, the hip, the lower back. So if someone is obese or overweight, then it means you're placing more weight on those joints. And therefore you find someone who's obese may actually develop osteoarthritis that is, at an earlier age than expected for anyone of normal weight. Yeah.
And now that we have talked about and unpacked that area about the bigger you are, the more predisposed you are to arthritis, talk to us about some of the myths and misconceptions that surround this topic of arthritis. Some would refer to it as, say, witchcraft. We started by saying it's dismissed as a normal part of aging.
Yeah.
So what are some of the myths and misconceptions that we as the general public have normalized that are actually not true?
Okay, so I'll begin with the most common one, thinking that arthritis is only osteoarthritis. But then, as we found out, there are other types of arthritis. Another common misconception is that there is the only way to relieve yourself of the osteoarthritis or arthritic pains is just painkillers. So, for example, you may find, so we have other therapies that we may do except giving painkillers. Of course, we'll give you painkillers to relieve the pain, increase the function, but then we also have things like physiotherapy. But then you find that patients are resistant to doing physiotherapy because they underestimate the role that it could have in
healing,
treating. Yeah, let's say treating, because
and we'll get more into treating as we continue this conversation. So you've said this is not only an older people disease. How does it present itself differently in children, and what are the early signs that parents should look out for? If you're talking about at an older age, 50-year-olds plus are more clinically showing signs of arthritis, but how about these kids?
Okay, again, it's not common in children, but we do have forms that occur in children, what we call juvenile arthritis. And we actually call it juvenile idiopathic arthritis. Idiopathic meaning that we don't exactly know we can't attribute it to anything exactly that would be causing the arthritis. You find sometimes it's genetic factors that predispose a child to getting it, but even with the presentation, you have it's the same thing all over. Pain in the joints, so the child will be complaining of joint pain. You may find them having some swelling. They may complain of reduced movement or discomfort, for example, when doing the same activities as other children. So now what happens with the juvenile arthritis or childhood arthritis is that people are not accepting of that, or even parents may be skeptical of that diagnosis. How is it that my child has arthritis? But that's again due to the misconception that arthritis is only osteoarthritis, which is common in the elderly. So again, if a child is complaining severally of joint pain or swelling or discomfort, then better to just take them to a pediatrician who will give a proper diagnosis. Yeah.
Are there, these types that we've mentioned, are there any that would say that maybe is hereditary? Because we've heard of, if you talk about lupus, we've heard of sometimes lupus being hereditary and being in the family line.
Yeah.
Is that with every type of arthritis, or lifestyle disease? Is it a lifestyle disease or a hereditary disease?
I'll say again, osteoarthritis is neither hereditary nor lifestyle. Although being obese does increase the likelihood of getting it, and even getting it at a younger age. There's some genetic factors, but osteoarthritis is basically that with time the joints are wearing out. The cartilage is being destroyed just because of aging, sort of the way the skin will age in any person. And therefore you develop osteoarthritis with age. Then when it comes to gout, it's more of a lifestyle factor actually. So you find it's common in men because of the kind of diets they may have. So red meat plays a big role, excessive red meat, and alcohol. So that causes a lot of joint inflammation and accumulation of the uric acid salt that I was describing earlier. So in someone who has gout, then that is a predisposing factor, the alcohol, the excessive red meat. For rheumatoid arthritis, it's mainly a genetic disease. So you may find that one of the relatives had rheumatoid arthritis as well. But then it's not purely hereditary. You still may find someone who didn't have relatives who had it. And on top of it, smoking also just predisposes one to developing rheumatoid arthritis.
Have there been cases for you, of course, as practitioners and doctors, where you've had cases where arthritis has been misdiagnosed before and has been confused for something else? Because we've had of other conditions that people go to the hospitals and they're told, oh, you're suffering from this. They go to another practitioner and they're told, no, it's this, and the third one maybe just gives a third eye and says, you could be having arthritis. So has there been any cases of misdiagnosis, and how prevalent are these cases of misdiagnosis, if there are?
Okay, when it comes to osteoarthritis, because again, the public is quite informed about osteoarthritis. They expect it to be in the elderly. They expect that it's the knee which will be affected. For us, the test that we begin with, which is X-rays, which are relatively cheap, give an accurate diagnosis. So you find that osteoarthritis may not be as misdiagnosed as, for example, rheumatoid arthritis. So with rheumatoid arthritis, there's a challenge of diagnosis because you find that it involves some genetic tests which may not be readily available for all, or even affordable for many people. So I think the time it takes to diagnose rheumatoid arthritis may be a bit longer than osteoarthritis. So one may dismiss someone as simply generally arthritis, and yet it's rheumatoid arthritis, which means that even the treatment may be affected and proper treatment may be delayed. Even for gout, you may find that there may be a challenge, but most commonly, I'd say in my experience, you don't find arthritis being misdiagnosed.
It's just easy go. You've talked about the causes. You've talked about things that predispose, somebody to arthritis, alcohol, maybe diet, and sometimes genetics. But now, what are the early signs or symptoms that we as the public sometimes, don't pay attention to? We'll just say that, maybe you're too new chungu kidogo to on the knee, and my elbow, my knuckles. So what are those signs that, we often overlook?
Most commonly, the pain will alert you to arthritis, because that's the beginning. That's the beginning of the disease. By the time you get swelling or deformities, of course, it's way more advanced. Yeah. So most often it will be pain. What may make people delay the diagnosis is, for example, denial in a younger person that I couldn't be having arthritis at my age. So I'd say pain is mostly it's the most common presenting thing that will make someone come to the hospital to seek care for the arthritis. Yeah.
So signs and symptoms, just the pain? Pain will take you to the hospital.
Swelling. In the case of septic arthritis, they may have things like fevers, although septic arthritis is not very common. Swelling. By the time you find someone who has a deformity of a joint, it's been something that's been going on for so long, so the pain will have brought them to hospital already. Yeah.
Let's talk to us about gender as well, because you talked about gout being more prevalent, in the men.
Yeah.
How about women? And if you talk about osteoarthritis and rheumatoid arthritis, and of course septic and lupus, which gender is more, predisposed to which type of arthritis? And we also hear about sana men, their health-seeking behavior is very, very bad.
Yeah.
So even as much as you look at this gender perspective in broader length, who are more affected from your, of course, professional work? Okay.
When it comes to osteoarthritis, it tends to be more common in the female population. Some of the things that could result in that is the fact that usually estrogen plays a role in bone strength. It's a long explanation where it helps with calcium absorption and therefore with bone strength. So you find that with age, when postmenopausal women, once the estrogen levels lower, then they're more predisposed to osteoarthritis. When it comes to rheumatoid arthritis, you also find that women are more affected than men, perhaps because it's just a hereditary condition and then presents more in females. Then when it comes to gouty arthritis, because of the factors involved, which is mainly alcohol and the red meat, which men are more likely to consume more alcohol than women are, and therefore you find that gouty arthritis is more common in men. For something like septic arthritis, we may not necessarily say men or women, because what happens by the time someone is getting an infection in the joint, it's because they have low immunity already, either due to diabetes or HIV, and therefore that may just present equally in both men and women. Yeah.
All right, and I'm looking at a certain data here, and they said recent estimates show that 595 million people living with osteoarthritis, and when we add rheumatoid arthritis to the cases, then the total could move to 600 million, and these numbers have been climbing for the past 30 years. If you're looking at in Kenya, 1 in 4 adults maybe being, predisposed or could show signs of having arthritis. Do you see this becoming a public health threat in the country? Or we are not there yet?
I don't know. I think because Kenya is generally a young population, I wouldn't say that arthritis is something that's that common. But at the same time, you find that with osteoarthritis, because of the chronic pain, joint discomfort, then you find that affects the quality of life and even the ability to function in daily activities. And so in that way, then it affects the population mostly because people are unable to just function in their normal capacity. Yeah.
Talk to us about the role of, and that question that I've asked you about this data, and you maybe, if you're seeing it as a public health threat. I was trying to look at that data, so it's somewhere that by the year maybe 2050, they're saying that the number of arthritis cases could rise if people don't take care of themselves. But now, how should we be taking care of ourselves to just prevent any rising cases of arthritis?
Okay, so some of the reasons the cases could be rising is, of course, with better health care, you find that people live longer, and therefore, with osteoarthritis being the bulk of the arthritis cases and it being in the elderly, then with time you find that the numbers will rise simply because we're having a bigger elderly population than we had in the past. Then on top of it, because of, you'd say rates of obesity and being overweight have increased with time in the country, then you find that even osteoarthritis, due to being overweight or being obese, will continue. The cases will continue rising for that reason. other lifestyle factors, if smoking and smoking, alcohol intake, excessive alcohol intake, lack of living sedentary lifestyles also, because we find exercise plays a protective role in preventing arthritis, at least osteoarthritis. So the more sedentary we are, the more overweight we are, the more we smoke or take alcohol, then the cases of osteoarthritis will keep rising. Yeah.
And on that mention that you've just mentioned, you know, when you talk about physical activity, gym, and just being active, could excessive, you know, gymming and, you know, physical activity expedite cases of arthritis?
Yeah, you do find that for people who are, for sports people, that they're predisposed to osteoarthritis, particularly because of the repeated use or rigorous use of their joints. So osteoarthritis happens because we're losing cartilage. The cartilage is slowly wearing away, and therefore for people who are involved in rigorous physical activity on a repeated basis, then they tend to be predisposed to osteoarthritis. But then in my opinion, I think that in the general population, we are under-exercising anyway. So by the time you have osteoarthritis due to exercise, it has to be someone who's a professional sports person, for example. I don't think in the general population you'll be finding that someone exercised themselves into, you know, developing arthritis. Yeah.
How about somebody who already has it and that are just trying to, you know, work out? So that would mean that if they, you know, exercise excessively, then that could lead to maybe kuanguka tena and just increasing the rate at which that arthritis was already presenting itself.
Actually, that's one of the myths. You had asked me earlier about the myths that exist regarding arthritis. So because with arthritis, you find that with movement, the pain will make you feel that you're worsening the arthritis. But actually, exercise tends to improve the life of one who lives with arthritis. So what it does is just strengthen the joints. And therefore you're able to, you actually slow down the process of the progress of the arthritis. Yeah, so exercise is not bad. It's just a matter of doing gentle exercises that one can handle. Yeah.
I've heard of cases where sometimes, you know, when arthritis starts presenting itself, then somebody will notice things like deformities, say on the legs. It could be bowed legs, knocked knees. How does it get to that point where, you know, somebody who's not born with these deformities now get to that point where they're having now bowed legs, their knees are now knocked?
Yeah.
How does it get to that point?
Okay, so taking it back to the fact that osteoarthritis develops because there's destruction of cartilage, the wear and tear as we call it in the public. So the loss of cartilage with time means that the bones are rubbing against each other, and the more the bones rub against each other, they kind of form what you call osteophytes, which are excessive bone on the edges of the joints. And so with time, that becomes a joint deformity. And by the time you get there, then most likely we'll need an orthopedic surgeon, that's a bones specialist, to assess you and perhaps even replace the joint. Yeah.
So how about the people who are already born with these disabilities and deformities, those with, say, rickets, knocked knees, bowed legs? When they now present with this signs of arthritis, then how does it affect them differently from somebody who is now just catching up with, you know, or just getting bowed legs and these deformities in the later days?
Okay, so already with the rickets, there's reduced range of motion, meaning you may not bend the knee or move in, have the same level of joint mobility or flexibility as a normal person. So when arthritis develops, and that means you're having even worse presentation of that and more reduced mobility, further reduced mobility, further complications of just being unable to function as normally as one would without the complication of rickets. Yeah.
All right, let's get into the topic of treatment. And a lot of people may wonder, can it be slowed down? Can it be reversed?
Yeah.
Can it be cured? And can it be prevented? Talk to us about that.
So when it comes to osteoarthritis, it's a progressive disease. And to be honest, it has no cure because it's something that is happening due to age. Again, I tend to use the example of your skin aging is not reversible or curable. Yeah. So because it's an aging matter, then you find there's no cure for osteoarthritis. What there is we tend to treat it mainly with painkillers that improve the quality of life, reduce the pain, and therefore enable more function. So these painkillers are often anti-inflammatory because what happens in arthritis is excessive inflammation, and so we are trying to slow down that inflammatory process and therefore improve the quality of life. Then in our practice, often we give supplements that improve the cartilage function or improve at least the cartilage, preserve the cartilage. So these supplements contain minerals and vitamins that preserve cartilage, and therefore that also slows down the symptoms of cartilage loss, which now lead to osteoarthritis. So such supplements include vitamin D, calcium, some collagen supplements, and therefore that helps to slow down the progress of the disease. Again, exercise, physiotherapy plays an important role in increasing the joint mobility, reducing that stiffness that one experiences when they have arthritis. And finally, if you find that the pain is not reducing, then you find that some bone specialists will inject steroids into the joints. So the steroids are also anti-inflammatory. They reduce the inflammation of the joints. And that helps to improve someone's life. With more advanced disease where what you're talking about, the deformities, you get to the point of deformities, then that needs assessment by an orthopedic doctor, bone specialist. And then they may actually require replacement of the joints.
And I wanted to ask you that question. I don't know if you're the better person to answer it. But now, say that there could be a replacement in the joint. That means metal or anything that is placed there to just help in movement. How does it now affect the quality of life if that, that metal is put inside the body to replace that destroyed joint?
Actually, it really improves. You find the elderly who've had joint replacements, they do much better with the joint replacement. Because by the time you need a replacement, it means that the joint was almost stiff, you could barely bend the knee, for example. And with replacement, then you find that there's much better mobility. So the limitations may just be simply after the operation, where of course you need time to heal. But once it's healed, patients have a much better quality of life with a joint replacement. And back to your question, you asked about the different types of treatment. So all I referred to was osteoarthritis. So in rheumatoid arthritis, then you have other drugs that are particularly used in rheumatoid arthritis. In gout, you have drugs that will reduce the amount of uric acid in the body and therefore reduce that salt accumulating in the joints. For septic arthritis, that's a different case where you need antibiotics to clear the bacterial infection. So every type of arthritis will have its own particular treatment.
Back to that question of joint replacement. And you've said that it could improve quality of life, and sometimes it prevents that stiffness, of the joints. But we've heard of cases where I've seen a case where somebody's, was aliwekewa chuma, and then now once that tumor was removed, then they weren't able to bend their knees afterwards. So of course, this is after not arthritis, but after, say, a small accident, they fell, and that bone broke. But now, how does it now present itself later on when, say, there's wear and tear afterwards? Does one need to go back to surgery?
You mean wear and tear of the replaced joint?
Wear and tear of the replaced joint, if there would be surgery needed, say after 5 years or 10 years, to just replace it again once we say maybe kulikuwa na pass inatoka after that chuma was placed.
Okay. So just to start, with the joint replacement, you're not getting the wear and tear because it's metal or whatever material is used doesn't have. It's not the same mechanism as if you had cartilage and the cartilage is being worn out. So with the metal, you're not having that happening. So you won't have osteoarthritis on top of that joint. But
so the metal that is placed when one has an accident is different from the one that is placed when we are dealing with arthritis?
It's the same. It's maybe the same material, but a joint replacement is not the same as using metal to repair a fracture, because those are two different scenarios anyway. You're having a fracture where the bone is broken and you need to put it back together, so to speak. But in replacement, you're actually placing that metal, and it's not something that you later remove. And actually, the replacements tend to last 10 to 15 years. So you find if it's something that's done at the age of 75 or 60, then you may actually live with it for the rest of your life. And so there's improved quality of life.
All right. Yeah. Actually, we have a caller for you. He's calling from KC. Good morning.
Morning.
Yes, good to hear from you this morning. Kindly introduce yourself and talk to us.
Sasa nataka niulize hivi. Kama huko wewe na iko na dalili inaanza ya hiyo mambo ya arthritis. Sasa kuna dawa ya kuzuia haraka ama hiyo arthritis inatokana na nini?
All right. Kwa majina umesema unaitwa nani?
Naitwa Julius Onchia, kuna iko hivyo.
Asante. Dr. Julius is asking about the medication that is available, especially for people who are in the colder areas. That is the question.
Oh, medication for arthritis in the colder areas. There's really no difference between, in terms of environment, the type of medication. So anyway, what you're looking at with osteoarthritis is particularly anti-inflammatory medication. So that means you may not necessarily be using something like Panadol to treat arthritis. You'll be using classes of drugs. The most common of those drugs is Brufen. You find Brufen, if you go to a pharmacy and ask for anti-inflammatory painkillers, then that's what you use to treat arthritis. They're very commonly available in the pharmacies. Yeah.
All right.
And there are several types of the anti-inflammatory drugs that are used to manage the arthritis. Then again, we like to give supplements for that. One thing I didn't mention is, aside from the oral anti-inflammatories, we also have gels that you can apply around the affected joint, for example, around the knee.
That is about home management.
Yeah. Those help to relieve the pain. They are found over the counter in pharmacies. Yeah.
So it's just, must it come from the doctor that, of course, what is it called? The description by the doctor, or they just have to go to the pharmacy and say, I'm having 1, 2, 3, and I would need an over-the-counter drug to help me deal with this pain?
I would advise people to seek medical treatment. The reason being, you want a proper diagnosis to begin with. You don't want to just assume that any pain is simply osteoarthritis. You may be right. But then at the same time, because we don't just simply want to take medication endlessly, we want to see if you need other treatments, other treatment modalities like physiotherapy. If it's so advanced and someone needs joint replacement, no amount of painkillers will
save that.
And also to get supplements. Those you can also get over the counter. So definitely advise someone to first at least get a diagnosis from a doctor in the hospital. Yeah.
Would that affect fertility in any case? That constant taking of arthritis, medication to try and manage and maybe just ease with pain. Would it affect fertility, especially on either gender?
No, it may not affect fertility, but these common drugs that we use in the anti-inflammatory medication is not advisable to use during pregnancy. It has effects on, especially in the first trimester, it has effects on the fetus. Meaning it may result in heart disease in the
How about somebody who's been taking this medication for a very long time before even trying to get pregnant? Would it be something that would affect them if they want to try for a child?
No. I mean, I've not heard of that. What happens is that we advise that you don't take the medication while pregnant because of the effects it has on the fetus. You asked something else that.
Oh, all right, maybe it's slipped your mind. But let's talk about the cost of treatment. You said maybe getting X-ray could be a little bit cheaper because to try and see the type of arthritis that one is presenting themselves with. But is this something that any Kenyan could afford? Say somebody from Wajir, those far-flung areas, is treatment affordable?
When painkillers are affordable, I'll say the cartilage supplements that I mentioned earlier are not very affordable. They may not be easily accessible for everyone. Physiotherapy is also not very easily accessible to everyone. It's quite costly because the thing is, even with physiotherapy, you probably need a number of sessions. So that is not something that every Kenyan can afford. And of course, when you talk about replacement, that's the most expensive of all of the treatments. And I would suppose that's why many people will just fall back on just taking the painkillers. Yeah.
So what happens if somebody cannot afford treatment for arthritis? Do they just go for this over-the-counter drugs for the rest of their lives?
Yeah, most of the time, as we said, osteoarthritis has no cure. It's a progressive disease. So what we advise patients is just take the painkillers whenever necessary, and not that you're taking them as one would, for example, in a case like diabetes, where you just have to take the medication whether you feel any symptom or not. So for osteoarthritis, what we advise is try to take the medication only when necessary. And the thing I wanted to mention is why it's necessary to see a doctor is because some of those anti-inflammatory drugs also have effects on the stomach. So you find people develop ulcers, stomach ulcers, because of repeatedly taking that medication. So what you want to do is at least have the advice of a doctor that take this medication only when necessary, take it for a limited amount of time, try to increase physical activity. So even if you may not afford the physiotherapy, the physical activity will help to reduce the symptoms of arthritis.
All right, we have a few feedback here. Hi, my name is Kelvin. I'm watching from Rongai. I'm only 32, but my knees crack every time I stand up. Is this an early sign of arthritis?
The cracking. Well, that's one of the things that people mention. So if it's associated with stiffness, meaning that you feel like you can't fully bend or stretch the joint, the knees, then you need a checkup. And associated with pain, then you need to be checked and see what that could be about. So one last thing I could mention is we find a lot of young people with joint pains, and in our setting it's actually just simply, you find that simply it's just low vitamin D in the body, and once it's corrected, then you're able to have full joint function, and the pain reduces. Yeah.
So how do we correct that vitamin D? Yeah.
So vitamin D, the form that is necessary for the joints to function, or for the bones to have strength, is we get it from being outdoors in the sun. So the sun rays converts the vitamin D. Even
for a 30-year-old, a grown adult?
You find that, at least in my experience, what I found is the younger people, treatment with vitamin D helps them to reduce the joint aches. Yeah.
All right. Dr. Njeri, this is Mama Jackie. I'm watching from Mombasa. Can arthritis be triggered by cold weather? My joints are always worse during the rainy season.
Yes, you find that not necessarily triggered, but it does aggravate the symptoms of arthritis. So even for people with rheumatoid arthritis, the joint pain is worse when it's cold. You find that even some people who have the metal plates will say that when it's cold, they even feel it more. So yes, cold does not cause it, but it just makes it worse. Yeah.
So what is the solution for these people who are in the say colder areas?
I would say just keeping warm will help to reduce that. Yeah,
All
and
right.
Obviously treating the arthritis itself will reduce that. Yeah.
We have more here. My name is Wairimu. I'm watching. This is Makongeni. My mom has arthritis and has been taking painkillers daily for over 5 years. Is that safe?
No, I'm assuming the painkillers she's taking are the ones we're talking about, which are anti-inflammatory. Taking those for a long time has bad effects on the stomach, especially even kidneys. So best that they see a doctor who can give them other options to manage the pain. Yeah.
All right. Daktari, my brother plays rugby and he injured his ankle last year. He's been having trouble with it. And could that increase any chances of him developing arthritis? Thank you for this conversation. Thank you so much.
Yeah, so people who are professional sports players, because they use the joints rigorously, rugby is quite rigorously and with repeated use for several, they also are more prone to injury. Yes, they are predisposed to arthritis, developing arthritis. Yeah.
All right. And finally, we have, this is Mark. She is watching from Kisumu. Is there a difference between gout and arthritis, or is gout just another name?
Okay. So gout is a form of arthritis. So arthritis is an umbrella term which refers to osteoarthritis, which is probably what the person has in mind. Osteoarthritis being the more common form in the elderly, affecting the knees. Then gout is another form of arthritis where what you're having is the salts, uric acid salts accumulating in the joints and causing inflammation in the joint. So gout is simply a type of arthritis. Yeah.
All right. Finally, on that issue of treatment, we talked about the cost of treatment sometimes cannot be accessed or assessed by every Kenyan. But how about these facilities that offer treatment for arthritis? Are they there? We're talking about these far-flung areas, the marginalized communities.
Yeah.
If they cannot access, say, level 4 facilities, then what is available for them, and how can they now, aside from we've mentioned over-the-counter drugs and painkillers, what is available for these people in these far-flung areas who cannot get access to immediate healthcare?
Okay, to begin with, anti-inflammatory painkillers will help to be used as per need. The supplements do help. Physical activity, even if one cannot access professional physiotherapy, will help. So that's a beginning point. And then if once able, try to reach a physiotherapy center where you can have those rehabilitation exercises done. And advise anyone with long-term arthritis to see a bone specialist and get a comprehensive assessment of what the issue is. And perhaps because every treatment is tailored according to every person, so not every person will get to the point where they need replacement. But at least for every person, you want to relieve the symptoms of pain and swelling and stiffness, and that's with painkillers and some supplements to start with, and physical activity. Yeah.
All right, Daktari, as we close and as we come to the end of this conversation, what would you tell somebody who is, afraid with this condition of arthritis in terms of just treatment and management in general as your parting shot?
I'd tell at least even the younger, at least one who's not already affected by arthritis. What you want to do is address those lifestyle factors. So managing the weight, living an active lifestyle, because that helps to prevent early onset of arthritis symptoms. Then for those who already have the arthritis, again, proper care is very useful. You don't want someone taking painkillers daily for 5 years without being assessed and getting at least other options for treatment that could actually be more beneficial than taking the painkillers.
All right. Asante sana Daktari for making time. We do appreciate your time. Okay, that is Dr. Sarah Njeri, a general practitioner. Let me give you a chance to say where we can find you.
Okay, so I work at Jalara Medical Services. So that's in Westlands, right next to the Oval. Yeah.
All right. That is Dr. Sarah Njeri, a general practitioner, of course, from Jaralam Hospital, as she's mentioned, taking us through arthritis and everything that we need to know about it, its causes, signs, and treatment, and, of course, management. That brings us to the end of this conversation. You're watching Morning Cafe. My name is Anne Odida. Enjoy the rest of your viewing.